Okay, for this electrical stimulation ultrasound unit, the electrode will be placed into channel 3. And when you end up putting the electrode in, it goes on all the way. It's going to be the electrode that has the tape on it. The other one does not have the tape on there. The start button is around here, and we'll toggle it on. The unit is now on, and here is the ultrasound head. And so the ultrasound lotion will go on to the arm. Well, here goes the electrode first. Put the application right here on the forearm. So the electrode will go onto the arm, on the forearm, because the treatment will be performed on the dorsum of the forearm. Okay, so when we turn on the unit, you will turn on the combo for combination ultrasound E-stim. We're not worried about ultrasound, but the thing is, in order to use the ultrasound head, in order to use the ultrasound head as a mobile electrode, you have to set the unit up in combo mode. The patient's treatment session will go for 24 minutes. For demonstration purposes, we're just going to leave it at 5. Well, we'll move it up to 10. And you'll see that's for the time. It is on channel 3, which is channel 3 here. The combo button, of course, was already touched. This is now in sound mode. So the sound wave will be at 20%. The megahertz, the frequency will be at 3 megahertz. When you push the 1 on there, it's at 1.1%, which is negligible, so you don't have to have the unit on immediately. But the lotion should have already been placed on the patient. And then moving that, and then coming back over here, you push this button right here. That switches it from ultrasound to E-stim. It is now in E-stim mode, and as the person is using the machine and the electrode is in place, and then you will ask the patient when they start feeling the electricity, because then you will start turning it up in increments here. It goes at half increments, so when you push it the first time, it doesn't move. I've moved it second time, there's a 1. I push it again, you don't see it, but that's actually 1.5. Push it again, 2, 2.5, 3, 3.5, 4, and the ultrasound, actually we're going to be doing it on the other side of the forearm. Just go ahead and wipe that over it. Go ahead and put some more lotion on there. And now it's... Can you go ahead and push the power button as you're doing that?
Pointed towards it. Start button?
Yeah, it's actually the up button. There you go. Yeah. So that's, there's 5, 5.5, 6, 6.5, 7. I'm starting to feel a tingling in the forearm at the electrode. Keep going, and you'll see movement in the fingers in a bit. We're at 10, 11.5, 11, 11.5, 12, 12.5. I feel the fingers tingling. We're going to keep going until you see the fingers move. Now they're moving. Keep going a little more. 18. Okay, so now it's working there. Now hit the start button. Once you set that, hit the start button. And now we're running. And you can work different points along the forearm, trying to get any type of extrinsic muscles that you can get. Sometimes when I'm working with it and he's trying to find a good spot, he's actually very well versed to kind of, with your direction and observation, to manipulate the ultrasound E-stem head. Now, of course, no no ultrasound is being utilized at this point because, as we set it up, it's at 3 megahertz, 20% at 0.1. So that's would almost be considered a sham treatment for research programs. All right. The timer will go off and it'll shut down when it's all said and done. Just clean off the ultrasound head. It will be placed back in here. This electrode will be placed back onto the plastic sheeting. Try to remember which side the electrode came off of, because that way it doesn't get lose its adhesiveness by getting dirt or oils on the electrode by putting it on the other side. And then with the unit, that's pretty much basically what it is. And then, of course, don't forget to turn off the power button in the back.
Good to stop.
Yeah, go ahead and stop.